Hello there. Thanks for having me.
Thanks for being here. I'm going to give it at least 2 or 3 more minutes. I want to wait till Jen Saracidis gets on from the city as well, because I want to do around the room introductions to make sure, since she's the new director of CHHS, that she knows who's all on the call. So I want to wait till she's here in order to do introductions. In the meantime, if you are on the board, the couple times we've sent out conflict of interest forms, and I know out of the 20 board members, we've only received 10 back as of Monday. So if you haven't filled out the conflict of interest form, now would be a great time while we're waiting to fill the room to fill out the conflict of interest form.
Hopefully you'll resend those to me and I'll get them back to you immediately.
Yep, after we get off the call,
Yeah,
I'll get it to your Comcast.net right away.
okay, thank you.
I'm only on the conflict of interest form. I'm only seeing a version with your signature, Ben. Is there a version that was sent?
I may have attached. Heather had sent one. Heather, I don't know what the date was. You sent that out, but maybe I'll have Heather send. Maybe we just send it out one more time after this meeting.
And do you want me to send that directly to you or just send it to everybody on this call? It's only the board members that vote that need to sign it.
Yeah, I just send it to the board.
Okay, I'll do that.
We'll resend it out. I don't see.
So subcommittees don't need to sign it?
No, subcommittees don't need to sign it, just board members.
Okay.
Is that you, Jen?
It is. Hello.
Hey, you're here. So let's do around the room introductions. I'm Ben, I'm the chair of the COC, and I'm just gonna go around the room where I see people. So who do we got? We got Eric out in the valley.
Hi, Eric Robinson, Housing and Homeless Coordinator for the City of Spokane Valley, and I'm co-chair for the single subcommittee.
Thanks, Eric. Excited to have you in that role. Amy J.
Amy Johnson from SNAP Homeless Services, fairly new coordinated entry lead manager.
Excellent. Welcome, Amy. Devin.
Everyone, Devin Viviano, one of the new program professionals in CHHS, focusing on youth and young adult homelessness. So a lot of state and city funding, but also now also some ESG CV funds and COC related things. And I just recently agreed to serve on the, I believe, family subcommittee, right, Heather? I think that was the one, yeah, on COC. So I'm looking forward to that.
Excellent. Thanks, Devin. Dale?
Dale Brees, COC board member.
Excellent. Gage?
Hi, everybody. My name is Gage Spicer. I am the Youth Advisory Board Chair.
Bridget? Did we lose Bridget? Oh, we might have lost Bridget. Jen?
Jen Sarasides, CHHS Director, City of Spokane.
Glad to have you here, Jen. Jennifer?
I go by Jen, but I haven't figured out how to adjust all of my my names on everything. So call me Jennifer, Jen, Jenny. I answer.
I was just going to the next person, which is Jennifer Haynes. Sorry.
Oh, sorry.
Shockingly, there's more than one Jen.
That is surprising.
Jen Haynes Harder, Director of Housing with the YWCA and COC board member.
Excellent. Mark?
Hi there, I'm Mark Mackey. I'm the CEO of the Spokane Workforce Council and a COC board member.
Excellent. Morgan?
Morgan Smith, Built for Zero coordinator at Spokane County United Way.
Excellent. Heather?
Hi, I'm Heather Page. I'm the program professional for the HUD COC grant portfolio, working for the city.
Excellent. Councilmember Woodard?
Arnie Woodard, Spokane Valley Council. I've been on CLC before, but I'm on HCDAC and also participate in some other functions to do with homeless and the poor.
We're excited to have you here, and it's good to see you. Councilmember Peets?
Yes, good afternoon. Brandy Peets, Spokane Valley City Council, and I am just listening today as alternate. Thank you for having me.
Yeah, thank you for coming as an alternate. We really appreciate that. Shannon?
Boniface, Managing Director of Crisis Response for Catholic Charities and co-chair of the Family Subcommittee.
And Daniel? I can't hear Daniel. Can everybody else? Daniel works for the CMIS. He's head of the CMIS department at the city, handling all our data. And Tim, did I get you? Oh, you're muted too, Tim.
Okay, good, great. Good afternoon. Tim Crowley, Housing and Community Development Division, Spokane County.
Thanks, Tim. Good to see you. Amira?
Hi, Amira Julovich, PIT coordinator for the city of Spokane.
On Brian Walker?
Good afternoon, Brian Walker, Communications Manager for the NHHS Division, City of Spokane.
Excellent, welcome. Julie, who do I got? Kimberly. Kimberly's here, she's our host from the city. She might be muted. Julius?
Hi everyone, Julius Hendrickson, he, him. I'm the Anchor Community Initiative Coordinator.
Excellent. Robert?
Robert Lippman with the Spokane Homeless Coalition, COC board member.
Excellent. And Councilmember Zappone?
Yeah, Zach Zappone, City Council, Spokane. I'm only listening for a little bit before I take off, but wanted to pop back.
Well, we appreciate you being here, Councilmember Zappone. Thank you very much. And who did I miss? Oh, David, I'm sorry.
Dave Sackman, Catholic Charities, along with Eric, co-chair of the single subcommittee.
Excellent. And Andre?
Well, Andre Muzichenko with Spokane County United Way, COC board member.
Excellent. I know Dr. Lutz said he'd be late, but he'll be joining us. And did I miss anybody else? Okay, Jen, you've got a good idea of everybody that's here, and I wanted to make sure sometimes we just do it in the chat, but I thought it was important since Jen's new to the group that she kind of gets an idea of who's all here. And with that, one, I apologize that we had to cancel the retreat. And is that Angela? Angela Chapman's here too as well on our board from Transitions. But I apologize that we had a retreat planned and then we canceled. But Omicron, those numbers, if you've been watching the numbers at all, are pretty, they've hit up into the 1,600 mark, which was 4 times as many as we'd had. I've been exposed directly now twice. I get calls. I even got it on my cell phone that I'd been exposed by somebody in a vicinity of them, which is rather odd. But I did send out a chart, and we'll talk more about the retreat later. But I can't wait till we can do some stuff in person, and I'm hoping that sooner rather than later. And with that, we'll get to the consent agenda. There's one item on the consent agenda, which is the December minutes. There's one adjustment, so whenever somebody makes a motion, I'd like to make it with the adjustment. Barry from the Homeless Coalition is not an official board member, so we just need to, in the approved minutes, adjust him down to guest, I believe. Is that correct, Barry? Okay. So are there any questions on the minutes that I sent out? So I would entertain a motion to approve those minutes.
So moved.
Do we have a second?
I second Angela Chapman.
Thank you, Angela. And with that, all in favor say aye.
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 Opposed? Okay, minutes have been approved. I really appreciate that. And Councilmember Woodard, just for your knowledge, whenever I had dead silence and board members wouldn't approve something, Councilmember Haley was really good about stepping in and approving things for me. So just keep that.
Don't worry, that's my reputation.
All right, good. I appreciate it.
But I wasn't here for December. It's kind of hard for me to make the motion.
Understood. Additional approval items. We have, the first one is board changes. Spokane Housing Authority, Ariel's not here. I don't, oh, is it Ariel? Oh, Ariel's here from the Housing Authority, formerly of SNAP and formerly of the Spokane Valley. And she has vast knowledge of the system. Pam has a lot of moving parts at the Housing Authority. So their request of the COC is that Ariel slip into the official Housing Authority role. Pam will, I still call Pam a couple times a week to bother her because she was chair for 4 years. But that's the first change the executive committee is recommending. The second is switching out Gage Spicer as the youth representative for Lindsay Romero, and that came as a request from the youth subcommittee. And the third is just to accept the appointment of Councilmember Woodard, Arnie Woodard from the Valley as the primary representative from the Valley, with Councilmember Brandy Peets as the alternative. And so I would entertain a motion to accept those changes.
So moved.
Second.
All in favor?
Aye.
Aye.
Opposed? Okay, and the next issue I'm going to kick off is coordinated assessment process. And a lot of you, there were a lot of new city folk on the call. People have switched jobs. There's new board members. So I'm going to give just a quick amount of background before we jump into a proposed change to the coordinated assessment system. So the background is that 4 months ago, the COC and the city received a letter from our permanent supportive housing providers in the city of Spokane, and all those that offer permanent supportive housing, Catholic Charities, Transitions, VOA, signed on to this letter. And the concern was really threefold, and I think we're addressing kind of two of the underlying problems with this change. But what the permanent supportive housing providers have noticed, the first is, and this one's going to be harder in a longer term to address, but is that the way referrals were working is that the referrals, the population being referred out of coordinated assessment to permanent supportive housing and rising up in the SSTAT system and how we use and score things was not prioritizing as many members of our BIPOC community as the population living on the streets that we know is represented on the streets. So basically, it's the tool itself is not working and referring a higher percentage of white individuals into the permanent supportive housing. Now, fair housing rules say we can't actually use race as a factor to score because that would violate fair housing laws. So that one's going to take, and a subgroup formed. Andre, Julius, and Morgan have been working, but the changes they're bringing forward today address the second part of what has been noticed is that a younger population in their 30s that have multiple co-occurring disorders, so maybe they have addiction and mental health issues, and they're of a younger population, are being screened in at a higher rate than, say, somebody that is 55 and older, and they're being left out if they don't have multiple risk factors. And so we've been trying to address this. We've talked about it at our last two COC board meetings, and now Julius and Morgan and Andre are going to present and talk about what I attached the PowerPoint, but I want to spend a decent amount of time making sure we understand this, and I'd like to get to a vote today so that we can implement at least some changes to address some of the issues. And these issues are really important. VOA, I was on a call with them statewide with housing providers, and it causes issues if you have not an even population in your permanent supportive housing. In July, there were 3 assaults on staff. VOA has lost all of their permanent supportive housing staff. And so if we can't get the mix right in housing, it causes other ramifications to the housing system. And then you have issues. The board of directors of VOA had a very serious discussion 2 months ago about continuing to provide that service in our community. And if you think about the hole that would be left if we lost permanent supportive housing providers, it would be a disaster for our community. So that's why we keep trying to push changes and figure out. And so with that, I'm going to hand this over to Julius, Morgan, and Andre and let them go.
Great, thank you, Ben. So yeah, Morgan and I have been, and Andre have been leading this work group as Ben identified. We've got go over some of that backstory that we wanted to kind of ensure was highlighted through this real quick brief PowerPoint presentation here too, and just make sure that we reiterate some of those high points that Ben did a really great job of outlining here too. So yeah, as Ben noticed, this request for change was brought to the community by permanent supportive housing providers with a recognition that the high acuity rates, acuity meaning the represented through the full SPDAT scores as an assessment tool for our system, or creating high rates of violence within those buildings. And as this work group got together, also recognizing that a really specific portion of our homeless population were being served, namely white men, predominantly between the ages of 30 and to 50. So through that recognition, we and with some research that Morgan had completed, Morgan, if you want to go to the next slide. We came to some other conclusions as well, right? As Ben just recognized, fair housing laws ethically and legally prevent us from prioritizing folks based off of race, disability, gender, some of those other demographic pieces. Age is not one that's included in there, so this is a area that we can analyze, really testing a change in how our prioritization process goes, as well as some communication that namely Morgan, but Morgan and myself also just met with some folks from suburban Cook County last week, as well as an additional meeting to talk about their process that they had implemented through their Built for Zero initiative, prioritizing folks 62 and older in their community to create a greater degree of accessibility for folks in that age range to access this intervention that is, for some folks, really the only intervention that's available to or realistic for them to achieve their goals. In addition to that, there's been some other research, namely found by Morgan and research by Morgan that had been done in Europe, specifically Sweden, around congregate housing opportunities and increasing the age diversity within those, the intergenerational diversity amongst inhabitants of those spaces, created a higher degree of happiness and a decrease in loneliness and depression amongst folks who are living in those spaces. That access to intergenerational communication and shared learning produced better outcomes mental health wise for the folks living in those spaces.
Thank you, Julius. So we identified some primary, secondary, and tertiary goals of this pilot, which again, we want to really underscore that this is a pilot and a learning opportunity for our community based off of that research that Julius just outlined. So the likelihood of being prioritized for housing would be increased for the targeted age groups, which would be over 62, and then 18 to 24. The primary goal, of course, is to reduce active homelessness in the population for those target age groups. The secondary goal would be to reduce the evictions within the PSH projects and reduce length of time in a PSH project before moving forward. That secondary goal was really based out of some of the findings that suburban Cook County was able to identify of moving the older individuals who have different levels of acuity in, you're able to get them stabilized and then moving them on to a voucher or another program after their 1 year in a PSH program, which then opens up the unit for another individual. And then, of course, the tertiary goal would be to reduce the number of incident reports, which we see as an indicator of kind of reducing those activities that are seen in the PSH program and that have been asked for. So what would this look like? Right now, these are pretty averaged percentages that we're using as a placeholder, while we, with the blessing of the COC board, would be working with the CMIS team to figure out how we can get those most accurate demographics and those accurate percentages. But these are the placeholders that we are able to establish through rough estimates. So 10% of the PSH referrals would be going to youth and young adult, or would be going to young adults 18 to 24. 15% would go to singles over the age of 62. Again, the percentage is their representation in the overall population, and then the remainder would continue to go to single adults age 25 through 61. We did want to point out that all referrals within the age range are still prioritized by the SPDAT score. So we're not changing that, we're just changing the access by these other age groups. It will be assessed on an annual basis via the by name list, which we are continuing to bring into the community and have that reliable monthly updated data. And the percentages will match the rate in which the members of these groups are represented among the population of chronic homelessness.
And so just for additional clarity, I mean, ideally, we would like to use our local by name list data to establish these percentages and determine the rates at which folks within each of these demographic populations are eligible for permanent supportive housing. And recognizing that when those percentages are set, we do want to reevaluate those on an annual basis as those populations are bound to change. in lieu of currently having access to a singles by name list, which is very, very close on the horizon. Our community will have access to one very soon, but currently our community has access strictly to a youth and young adult by name list and a veteran by name list. We're not able to access that resource currently to initially set those percentages. And so yeah, and again, just to reiterate what Morgan had identified, that with approval of this, we'd want to work with Daniel and Teague in the CMIS team to ensure that we have a data source that could initially set those percentages for us.
Great. So a big part of this and what we want to ensure that is being done within this program is that we have a strong implementation and evaluation process, that we're not just starting something and not being able to follow through on how it's working. So we did set a date of February 4th, which is 1 week from this Friday. PSH referrals will be offered to those individuals in the waiting pool, as we've explained, until the allotment is filled or the waiting pool has no more remaining eligible participants. If the waiting pool is depleted before the percentage allotment is filled, an evaluation team, which could be made up of members of the COC board, we will take individuals into the evaluation team. It will also be made up of the PSH providers, can recommend that the age range is expanded. The efficacy will be assessed on a quarterly basis based off of those primary, secondary, and tertiary objectives that we named earlier. And then the effectiveness of the process as a whole will be analyzed at an 18-month period. The reason that we set it out this far was because of the long-term goal. We want to be able to see after 1 year, is this increasing people moving on like we initially thought it would. So I'm going to stop sharing. Oh,
I was just going to say, and again, the data that we would use in order to analyze the efficacy of those goals and how near or far we are from achieving those, again, would ideally be used either or pulled from our by name lists, and then some of that information obviously would be reported directly from the PSH providers themselves. Certainly like incident reports and things like that. But that data would ideally also be coming from our by name lists as a community resource that we have.
so I'm going to stop sharing so that we can see each other to answer any questions, but I can go back to any slide that is necessary.
Julius and Morgan, great job. Appreciate it very much so. A good presentation. Now, this isn't something I want to look at and ponder for a while. So let's ask questions if we can, so we can get to a vote today.
Why was 62 chosen and not like 55 as the age base?
It was chosen simply because that was what our partners in suburban Cook County had done. And we've also seen that there is a wide range of individuals over the age of 62. That also is kind of the national standard. But we are able to adjust that. And as mentioned during the assessment processes, if we do end that chronic homelessness for people who are over the age of 62, that age can be reduced and the age pool can be expanded.
Yeah, and the reason I ask is because there's in the senior living environment, it begins at 55 for some complexes. And so if we can match up to that at some point, I'm not going to, delay this, but it's just something to consider. And also realize, like a year and a half ago, we heard from, some PSH providers that they had a higher incidence of death of 50 on up people living in. And so if we want to decrease death within the community, people on the streets might know they have health complications, and that might be something to look at later on too. So.
Hi, yeah, that's excellent feedback, Dale. Thank you.
Quick question to incredible work, Morgan, as always.
Your speaker, please.
Yes, can if I speak a little more loudly, can you hear me?
That's a little better.
I'm having audio issues, and I apologize, everybody. So my question, Julius and Morgan, have you worked with the coordinated entry leads on being able to pull that data as of February 4th? Pull those referrals, excuse me. Are they aware and they're queued up and primed and ready to go?
Yeah, so Amy, who I believe is here today, right, is one of the many folks from our community, and as identified, right, like we've also been speaking with folks from outside of our community who've tested similar pilots. But Amy's certainly one of those individual people who have been a part of this conversation, and we've been sharing a lot of our like plans, intentions, and some of these like deadlines and guidelines along with her as well. But certainly, yeah, I mean, she's here today, so she could also speak on her opinion on there too.
Okay, I just wanted to make sure in case Shannon, Amy, and I need to get together to figure out how, as of February 4th, that information is being kind of pulled down from the CMIS. So maybe that is something we can talk offline about as that date comes closer. Thank you.
Yeah, we certainly can, Daniel. You know, I think as it stands right now, we'll be able to filter the list the way it is to those age brackets that we need. And yes, I've been in contact with them. I didn't know of the exact date it was happening, but I knew it was coming down the pipeline.
One last question. So the percentages would be percentages referred in or percentages of PSH units that are in our portfolio?
Yeah, so we would want the percentage of units that are available for, you know, however that percentage is determined, to be consistent with the percentage of folks from those age ranges who meet the eligibility criteria for PSH. So yeah, it'd be of the units that are available. And of course, as capacity within our permanent supportive housing system changes, right, as units are either added or, you know, all you know, against all hope, you know, potentially subtracted, we would want to make sure that's why we wanted to go with a percentage rate as opposed to like a fixed number of units, as those things also are bound to adjust over time, or likely to.
Yeah, and I just for other members of the board that might not know, our portfolio includes, you know, some of the like the Donahue Haven, Marilee, but it also with VOA there's a scattered site model that rents from private landlords that is a little bit, you know, so that's varied, so it's not just blocked into the brick and mortar of some of the buildings downtown, and so that portfolio is more expansive of, and then maybe we should go in with the baseline of knowing who's in those, so we can, you know, get more to what we're doing with the percentages. So.
Mr. Chair?
Yeah.
Barring any other discussion, I don't see hands raising or people wanting to talk. I make a motion that we accept what's been laid out today on those percentages, and let's move forward.
I second.
Excellent. We'll leave space here for any more discussion. I do get the baseline, Dale. So we probably, and Daniel, yep, there's going to be some implementation, and I'll help out, and I know Dale will, and Julius and Morgan on whatever we need to do to get this done, but it's much appreciated. And with that, all in favor say aye.
Aye.
Opposed? All right, everybody. We'll keep track of this and keep you posted. And thank you very much. And Councilmember Woodard, you are, that's great. I appreciate it. And with that, we'll go to, I think I don't think we have any other votes. Everything else is updates as far as I can tell. And they're quite a laundry list of them. But I think they're all important. But I just wanted to, on the email I sent on, I believe it was Monday morning, there was some language that has been posted, and Heather can tell us, but it's about the board openings. And there are 4 board openings that we had people that termed off of the board, and that is the K-12 system, our business representative, And our temporary shelter representative moved and took a new job, and law and justice. And so those are the 4 openings. And Heather, where all have they been posted so far?
So they have been posted multiple weeks on the community update that goes out from the city. They've also been on the CHHS updates that go out. They're on our website, and then there were 2 other places that they were posted as well, and I'm sorry I don't have them off the top of my head. It's all been electronic recruitment at this point in time. And the language was in the email that been sent out. So if any of you know of folks that might be able to fill one of those roles, we'd welcome those applications. At this point in time, we've received 2 applications, one for the temporary housing provider representative and another one that doesn't really fit one of our openings at this point in time. However, in the future would probably be a good consideration as a landlord. And so once we've closed the application period, I can communicate with that individual and let them know that we didn't have that opening available at this time. So we still have 3 positions with no applications. We would welcome that recruitment if you know of folks that either fit that K through 12, that business role, or that justice system role.
And Brian, does it go out on city social at all? Can we make sure that it gets out? Oh, Brian, I don't know, I can't hear you now.
Ben, it did go out on social.
Okay.
Brian is the one that sent all that out. So my apologies for not mentioning that one.
Okay, I just want to but everybody that's on this call, we need strong board members. We don't want to strong arm somebody to joining because then they don't want to be here and don't participate. So we want somebody that would participate, that would fit one of those guidelines. We do need to fill those. So if everybody can please circulate that or give it some thought. If you have names that you want me to call, email me their name and I will call and talk to them about being on the board. You don't even have to do it. Just give me a name and a number, or a name and an email address. But do really need everybody really kind of focus on this for the next couple of weeks to make sure that we get this done. I'd appreciate it. Angela, is that a hand up?
Yeah, so can you tell me what the justice role is? What is the guide?
It was Captain Singley, but I had been talking to the post head of the Law and Justice Council, but she left, Maggie Yates. So it could really be like if we had somebody that was involved in, say, the diversion center in the jail, or somebody at the jail, or somebody involved in any aspect of the criminal justice system or the law enforcement system. So it doesn't have to be, we're not pigeonholed on that one. That one's pretty broad. Does that help, Angela? Okay. All right. Any other questions about the board? If you need the language, though, let me or Heather know. But we really do want to get those 4 board positions filled. And moving on, and I put this in the chat earlier, somehow my chat bar, I can't even access the chat anymore. The conflict of interest statement, Heather or I'll be reaching out to you, but we've received 10 of 20. Have we received any more, Heather?
Yes, we're at 11 now.
We're at 11 of 20 conflict of interest statements. This is a HUD requirement and a requirement per our bylaws and internal rules. And like when we were filling out that NOFA last fall, and it was a pretty rushed process, but we had to mark no on a couple of the logistical items that we hadn't done. And so what Heather is really, and I know Jen has come up with a chart on responsibilities as well. They're working really hard to make sure that all of the little things that we can do now to make it really easy to fill out the NOFA this year, are done early. And so I've been really appreciating all the organization, but we have to do our part, which means to go back to Heather's emails. She has a blank one attached. Apparently, I attached one with my signature on it. But Heather sent it twice now, and we'll send it again after this meeting. But we need to get those back because I don't want to spend an hour some afternoon calling and asking you to fill out a piece of paper. That doesn't seem like a good use of either of our time. So we will send out the conflict of interest statement, but if you can do me a favor and fill that out and send it back. I know we had a request for it electronically, but we don't have the ability to do that right now. We need to fill it out and get it back, either mail it back to Heather or scan it in and shoot it over to her. So that's my ask there. And now we're going to go to home ARP update. Tim, you're in charge.
Oh, thanks, Ben. Say, Ben, if you wouldn't mind including in the minutes as they go out, a short one-page update. I think I forwarded that to you yesterday. If you don't have that, I'll resubmit it.
No, I will give that to Kim to include in the minutes.
Great. I'll make this brief. I don't know how many here have heard about the home ARP funding that came to the city in Spokane County in I guess late September. We were notified through Department of Housing and Urban Development via a grant agreement of funding that is really specific to serving homeless populations and families. It's in the case of Spokane, their funding is about $4.6 million. Spokane County is expected to receive a little over $3 million. Some of the activities that are eligible and development and supportive of affordable housing, tenant-based rental assistance, provisions of supportive services, and acquisition and development of non-congregate shelter units. So again, along with these dollars came the requirement that before you even consider allocating these dollars, jurisdictions are required to put together an implementation plan, which basically tells HUD how you're going to allocate these dollars, what you're going to allocate them to, and the backup that supports following that implementation plan. So this seemed to be a perfect opportunity, since we have a regional homeless plan, to look at collaborating with the city of Spokane in our efforts to put together an implementation plan. And we've done that so far. We have established a work group that meets on Tuesdays, with the county team and a city of Spokane team. And they're in the process now of looking at how we can consult with the primary agencies identified in the statute. One is the continuum of care, as well as homeless providers, and the other one is the public housing agency. So within the parameters of putting together this implementation plan, we need to really do some work before we roll it out and start seeking public input. We're hoping that based on our timeline, we will be making greater presentations to our advisory committee as well as the city of Spokane with joint presentations on what the plan entails and seeking input on how to allocate these dollars and what the high priorities are within the plan. So I think that today's topic was absolutely vital in looking at the coordinated assessment, coordinated entry, and looking at gaps that we currently have in our homelessness strategies. Again, I think that what's important is that through this consultation with the public and the agencies and working with the city, we may have joint funded projects, we may have separate projects, but it's really an effort to look at how we can best utilize these dollars within the region. So I'm going to leave it at that. There'll be more information available. Again, I just want to remind everyone that these are not the U.S. Department of Treasury dollars that you hear about that are going to the city of Spokane, Spokane County for allocation. This is flowing through the Department of Housing and Urban Development. It's one-time funding, and the grant runs for approximately 10 years. And the clock started on October 1. So we're going to put as much time and effort as we can to put together a good implementation plan, submit it to HUD, and hopefully they'll receive it and approve it, and then we can start implementing the plan that we created. So that's it. And again, Ben, if you wouldn't mind including that summary in the minutes, I'd appreciate it. Thank you.
Thanks, Tim. I appreciate it. Look forward to more updates on that and that money out building housing. That's great. Okay, next updates. Jen, I got you on for the Way Out Shelter and Warming Center.
Thanks, Ben. So for the warming center, we continue to work to find a location that will work for this, and we're hoping that we're getting really close. Unfortunately, I don't have any good news to share with you all on that topic right in this moment. And then as far as the Way Out Shelter, I don't have a lot of update on that as well. I know that there's a group that's going to meet to kind of just talk through that process that is being utilized to access that facility, but we haven't had that meeting yet. So I wish I had some additional information to share.
Okay. Any other updates from the city on your end, Jen? And we're just excited you're there. We know how busy you are.
Thank you. We just continue to work on staffing up. We have some program manager roles that we're working on filling, and then just continuing to work with some of our newer staff and really just kind of rebuild the department. So that is what we've been focusing on, and then also making sure that we are supporting the COC the way that we need to be. And so Heather and I have been really working through that and making sure we're aware of the needs and the requirements in the MOU and assigning a staff person to each one of those tasks. So it's really easy and clear for you all to know who you can reach out to for assistance. So thank you.
Yeah, and I personally, and I know the COC appreciates it, all the work you've been doing. And it's nice to be on this call with so many City of Spokane employees. So that's great. We had a little dip there for a while, and we're really excited. So welcome aboard, and we look forward to continued partnership as we move forward. And I think, is Amira on and Daniel both? Do you guys want to handle a pit update?
Yes.
Yes, we do. I'm going to share my screen. Can everyone hear me okay? Or relatively well? Great. So I'm gonna lead in with I think sort of the top of mind piece here with the point in time count. It was scheduled to start tomorrow. We gathered information from stakeholders and public safety across the city and the county, and based on the feedback we got from this board as well, thank you, Ben, for providing some input. We moved the point in time count date. That date has moved to February 24th, and the unsheltered count, so that's the kickoff date, and that's the date where we count all the folks in shelters. And then our unsheltered count begins, and that's, I think, for a lot of folks, that's the number they're looking to see, how many people are on the streets. That's going to be conducted between February 25th and March 1st. So I'm going to say that again, just so that it gets registered with everyone. The point in time count is not tomorrow. It was approved to be moved by HUD to February 24th. So that's the new date for the point in time count. With that, I want Mira to kind of lead in with some of this general info, and then I'm going to go into the project plan. Try not to take up too much time. I'll go through it briefly, and I can follow up with this group with more details should there need to be more. With that, Amira, can you kick us off on what February 24th is going to look like and what we can do now to plan?
Yes, thank you, Daniel. So the 24th of February will be relatively easy because that only includes the sheltered count. As you can see here at the very bottom, we have out of our 12 sheltered sites, 7 are using CMIS, 5 are not. So the ones that are using CMIS will get that data pretty much automatically. And then the remaining 5, we will work with them to teach them how to use the app that we'll have effectively. So then the 5 days following the 24th is our unsheltered count. And that's obviously a lot more work, a big geographical area to cover. And that brings me to my biggest ask, and that's volunteers. I will send in the chat and I'll email everyone on this call some info about how to volunteer and just more info about the pit. So if you would like to volunteer yourself, or you know of anyone who would like to, please feel free to share the information that I'll send to you guys. So it's a big effort. We need all the help that we can get. And we are aware of COVID measures. Obviously, we will follow all measures in place. If you decide to volunteer or someone you know, please be assured that you will get the best PPE and the best support from the city and the Spokane Regional Health District. So if you have any questions, feel free to email me or ask in the chat or ask me now, whatever works for you. Yes.
Amir, this is Daniel. Do you mind letting people know what they'll see when they click on that volunteer portal and what kind of they'll need to select?
Yeah, so when you click on the volunteer portal registration link, just you'll click through, you'll add your basic information, and then you'll have choices as to when you can volunteer, which area within Spokane County would work best for you. So yeah, it'll give you some choices there. And as always, if you have questions, please feel free to let me know. I'll include my email in the chat as well. But it should be pretty straightforward. We're working closely with Simtech, the developer behind our app, to just streamline it as much as we can to make it more intuitive. Yep.
So with that, I'll go into a little bit more detail on the plan. I want to first thank everyone that has provided input on the unsheltered piece and the teams being assembled for that. I know a couple people on this call are working closely with Megan Vincello. So thank you for that. So here we go. As Amira pointed out, the sheltered count is relatively easy for CMIS participating folks. We'll just pull that data down from the system on the day of the count. Really, the unsheltered count for those 5 days, we asked them where they stayed the night of the 24th. The outreach team, we're going to be surveying zones, so that's sort of the best approach we have now. Megan is creating zones, and on each day we're going to have different volunteers go to each zone, including the Valley. I want to thank Tim Crowley. We have a meeting tomorrow to talk about areas that we need to reach, and we're really trying to empower each community in the surrounding area to give us the best plan that they have to approaching their community, their unsheltered community. So on the day of the count and leading up to it, we're going to have a sort of an incident command method to how we manage our volunteer groups. We're going to have team leads, volunteers, the buddy system, and there's going to be 3 main supports during that the week of the pit. We're going to be working with the fire department. Megan and Amira are going to be sort of the staging managers, and I'm going to be supporting the technology pieces. And we're going to be coordinating any troubleshooting, any issues that come up with volunteers. And then roles and responsibilities, I've kind of got them outlined here. Too much, I think, to read to this group. Just to show you, we do have plans, we do have the details in place, and we're looking at, really we'll put this together to know where the gaps are. What may happen, you know, COVID has just shown us how flexible we all need to be. It could be the case that we just don't hit the volunteer numbers. And if that happens, we'll know where we need to fill in the gaps in the zones, and then here on our daily schedule, what we have planned for the week of the pit. And then should we have a shortfall, I think we're going to be working with everyone to have a plan B on all hands on deck, who can do what to make this unsheltered count as successful as possible. Now, the one nice thing about the change is the Homeless Connect event is going to be March 1st, and we're going to glide right into that with our unsheltered count. And that's just going to be a huge magnet event to sort of close the loop and catch any other unsheltered folks we hadn't through the deployments that happened throughout the week, throughout the county. Let's see here. There is some process here. This is really just high level. There's going to be a command center that we look in real time as the surveys come through. I'm going to be looking for any anomalies, irregularities in that data, checking with volunteer leads. Should something come up? Sometimes we have, you know, strange things happen where somebody's counted in the middle of a river, in the middle of the river. So I just have to call and check and see, you know, what's going on with that geolocation, you know, what could have happened there. Then after that, and I'm not going to read all of that, but after we get all that data collected, we scrub it, we clean it, we extrapolate for any missing data so we have a full picture. And then I'm working internally at the city to create a brain trust of sorts, bringing the best minds to create a presentation this year that really puts into context the point in time count. Let me say that again. We really want to put the point in time count into context this year. It's really just a measure, one measure we're checking for that one day. And we want to bring in other information to give some causal, correlative information to help us see the big picture here. And so if you have good ideas, feel free to feed those to me. I'm assembling that group of people. We should see things like eviction, housing costs, the newly released census data, to just bring it all together so we have a holistic view of where the point in time count sits with everything that's been going on in the last 2 years. So with that, I'm going to stop the presentation and open it up for questions for Amira and myself.
Daniel and Amira, thank you for the great report. I volunteered twice before, and I've signed up for this year.
I saw your name, Ben. Thank you.
I would encourage everybody, this is, of course, it's volunteer, but I found it very helpful in my work with this issue. And if you're working at a policy level, it's not hard. At least the year I went, the first time I went was the first time we were electronic. So we were working out kinks, but I bet it's even easier now. And it's not hard, but I think getting with the populations that we're working with is really, really important, and not sitting here on a computer or in your office all day long. It's very important to interact with people, to understand their situations. And I think it'll allow us all to do our jobs a lot easier moving forward if we've been out there. And this is one time, this is HUD required. This is a COC mandate. So I'm just trying to guilt you as much as possible to sign up to volunteer, go through the training, because we are, due to COVID, there's not going to be as many volunteers or people willing to volunteer. So it's going to come up to us making the decision to volunteer if we're going to get a number of people out there. So that's my pitch, but I think it would be important, and I found it very useful in my life to go out there and do it a couple of years as well. So that's my encouragement. I mean, ask your
Thank you,
friend.
Ben. Thank
Yeah.
you, Ben. I appreciate it. We appreciate it. And also, speaking of training, I do want to mention that all of our training is going to be completely virtual for everyone's safety. So rest assured that we're doing everything that we can to keep everyone safe, including our volunteers and obviously our homeless population.
A quick question in terms of the makeup of the volunteers. So I went ahead and signed up, but before, I wanted to connect with you all before I shot it out to campus. In terms of this is something that I could see college students potentially being interested in, but I don't know about the appropriateness / level of maturity that's necessary to effectively do this. We could easily send this out to all 4 campuses, 5 with WSU Spokane, so that they can inform their students of the opportunity. But I want to make sure that I have an understanding of what a quality volunteer looks like before doing that. So could you kind of help me just a little bit?
Brian, I'll jump in on that one. Let's talk afterwards. I do think my experience working with Dr. Anderson in the urban planning department and his team of students, we did a survey last 2 weeks now ago at the Warming Center, and these were urban planning students. And I think that experience, they were mature, they did the surveys, so I was really impressed. And I think now going forward, forever for that small group, it will be in their DNA, this population, as future planners. And to see that happen in real time and to see them experiencing that is just, awesome.
Oh, sure. I don't doubt the educational benefit for the students by any stretch of the imagination. I think it would be very eye-opening, especially, I'm even going to say especially for all the students, right? Regardless of what institution that there's a certain level of privilege. But I also know those urban planning students, I believe, are graduate students. And so that's going to be a different, a different batch. And so
they were.
Daniel, I'll set up a meeting. I'll send an email. You and I can chat just before I get something. And maybe we can even, identify, hey, here's what we're looking for in a volunteer, and then we can send something out.
Yeah, and I'll put Amira on first base for that.
Okay.
Sorry to talk over you, Amira. I'll just make sure you include Amira, Brian, and then to understand you better, I think you have some insight there we want to know about.
Yeah, and I did just want to mention, Daniel went over this briefly when he had the PowerPoint up. All volunteers will be in groups, right? There will be a buddy system, which for the rest of the group on this call, even if it's a younger person, they can learn a lot, they can help a lot, and they will not be alone. So just keep that in mind in case you have kids or loved ones that want to participate. But yes, any other questions?
Is there a deadline for the sign up?
There's no deadline per se. We would love to have people sign up by the 18th at the very latest of February. But like I said, we will have virtual training videos. So it will be relatively easy. One of the videos is already up. If you go to the Spokane city.org ending homelessness point in time count website, we posted a video there from the developer, and it talks about the app. So it covers the app. We will have more instructional videos to cover COVID and safety and just some outreach basics, but everything will be virtual. It will not take a lot of time. So if you're interested or want to talk more about it, please let me know. I'd love to connect with you.
Ariel?
Yeah, so I just have a thank you. So one, super encourage all the board members to participate in the point in time count. I think it's a really critical piece of just overall education. But then second, Amira, can you tell me if you all are working closely with our existing outreach teams? Is that happening?
from outreach teams from a specific?
Yes, I can answer that. Yes, so some of you may have already been pinged by Megan Vincello. I mentioned her name earlier. She's overseeing the outreach component of this. So if you haven't heard from her, and I know Ariel, she's been trying to connect with you, you will hear very shortly. But the teams that are, in our minds, Frontier Behavioral Health, SNAP's outreach team, Bob Peeler, Megan and Bob have a relationship, Tammy as well. I think some of the names that you've seen are some of the folks you already work with. I know Goodwill has a team, and all that is in place to bring those experts together. Yeah.
Great. Yeah, because I think that'll be key in making sure that when we're pairing folks in groups together, that you get the people that have been on the streets and know what they're doing to assist however they can.
Yeah,
So thank you for all your work.
Eric is on the call too, and I know Eric is. The gears are turning for him too over in the valley, or you just were Ariel as well.
Yes, and I know we're working with, I think,
Oh,
Homeless
look
Coalition.
at that. You just popped on.
Yeah, surprise. As well as Tammy and Megan, as Daniel mentioned, and we're actually trying to kind of more structure, I think, that outreach, kind of coordination. So we're gonna get better on that over the next few weeks, and certainly leverage that into the pit count and beyond.
Dale, did you have your hand up and then it went down?
Yeah, I do. Are we connecting with the foundational community support outreach providers also through the healthcare authority that are in our community? Because they're providing homeless outreach also. And I don't know if we've really, reached out to them. There's a list of 16 that was shared at the singles meeting the other day.
Yes, I think Megan is working to include them, but I will double check.
Okay, thank you.
Yeah,
I'll make a note of that, Dale.
yeah, and just again, and make sure that if it hasn't been forwarded already, that again, we're all for, I think, connecting to the right folks and stacking the deck correctly. So happy to look at all.
All right. Any more for Daniel or Amira? That was a great presentation, and we'll see you out there. Appreciate the work, and I do want to say that I don't believe in the past there's ever been anybody dedicated from the city side to the pit. Am I mistaken? Or I think it's just been a team effort. So having Amira on board, that's her 100% focus is great and appreciated.
Thank you, Ben. Thank you.
Yeah, and you've been doing a great job. So thank you.
Thank you.
Thank you, Amira.
All right. Brian Davenport, would you like to give an update on the racial equity work group? And I know you'd sent me an email yesterday that I have passed on because we do need to deal with that situation of people with lived experience. They have to get stipends, and June and Eric got my communication on that. We're figuring it out.
Excellent. So we did meet on Monday, and let's see. I don't know, Julius and Morgan, are you guys still on? So please feel free to correct me on anything that I say that's wrong from what we talked about, which I appreciate because they already have done that at our meeting on Monday as well, which is wonderful. So we met and we talked specifically about the anti-discrimination policy, and the group had some concerns, primarily with, I would say the two concerns primarily boil down to the process, in that adopting, basically just grabbing another community's anti-discrimination policy and swapping out geographic language was a little concerning for them. I did explain that some of that was just based on COVID and balls getting dropped with all the changes and things like that. But the next time around, I think it would be important to have more of a process community aspect to creating this type of policy. The other piece that a lot of folks mentioned is that it's very cumbersome. It's clearly designed to be more of a legal type document rather than a useful type document. And so some encouragement that maybe in the future we rework it a little bit so it's a little bit more accessible. Beyond those two things, there was some other pieces in wanting to have some action pieces to it, right? One of the things that it talks about in that policy is some ongoing education, and the need for ongoing education. And a lot of folks said, yeah, well, that needs to happen. Let's make sure that still does. And so, hey, we've got this anti-discrimination policy, so it's a what not to do. Now let's make sure that we have some things happening that really kind of start creating a community and an environment of what to do. One concern that was raised after the meeting, actually via email, is that class seems to be very much absent from this policy, which is interesting given the population that we work with. That socioeconomic status, those types of things aren't kind of named as something that we don't want to be used in some sort of discriminatory fashion. And then the final piece, unrelated to the policy, is kind of asking the group, said, hey, we would like to know what the COC wants us to accomplish. And so I have some very dated material that was in a strategic plan from a while ago, but maybe at the retreat, that might be something worth exploring, is what the COC would like to see from the racial equity work group, in terms of we're starting to get some data on what the situation is in terms of racial equity in housing. But then is the charge to do, create additional research to find out what can we do about it, those kinds of things. And so there's a little bit of question beyond the feedback on that policy. Any questions on any of that? I know I talked really fast, but I want to be cognizant of time.
Well, no, Brian, and I guess we were on a 1-day, 24-hour turnaround on adopting a policy because we realized we didn't have one. And
yes,
we needed to check that mark, yes. On
and that is something I explained and said, hey, going forward, yeah, you all are right.
But I'm not opposed to that group taking a stab at not just changing, but what does one look like that we should be adopting and discussing as a board? Okay. And I don't think that that's a bad thing to say. A goal for the next 6 months would be to work through what is a discrimination policy that's not just protective but proactive and includes class. So there's a document that gets brought back to the board. So we can talk more offline, but we can also, this should be added as a discussion point at the retreat, absolutely. But I appreciate you leading that work, and thank you. Are there any questions for Brian? Okay, thank you. With that, let's just kind of go to the retreat. I've gotten 10 responses on the doodle poll for the retreat, and all 10 of them said that Valentine's Day, February 14th, is a good day. Everybody's calendars apparently are free on Valentine's Day, and they'd like to spend it discussing this for 7 hours. And we'll feed you lunch. And we'll have an icebreaker to start with, so we won't start off cold. We're going to do some mapping exercises in the morning, and then we'll get into some discussion about coordinated entry and what does that look like to get a new SBAT system potentially. And then finish off with a very, very large discussion of how do we actually have a regional homeless plan. And we're not going to just be the COC meeting. We're going to invite the CHHS board, the county board. We're going to invite all of the elected officials. We're going to invite as many different, I think, Eric, I don't know, our list came up with what, over 100 individuals we want to invite to this meeting.
Yeah, it went up, but which also, again, as I recommended, I think, to you before, obviously having to kind of pare that down to smaller groups where people can feel like they actually have that voice and that input is is going to be key. So we might just have to look at how we ramp up some of those, or expand those small teams.
Yeah, we were thinking at one point it would be like what did we call it? Speed dating area, where you have a setup on, you have little small areas where you can go learn more about what coordinated entry is, and then for 15 minutes, and then go on to another topic. And we would be asking the coordinated entry folks, permanent supportive housing folks. Each part of the system would have a table. We do this over at the convention center. They are available on February 14th. And I'm really sorry, I can't see my chat function on my screen. For some reason, it all disappeared. But Brian, you had put something in there.
Just that I have one conflict on that date. And so if it is that date, wondering about the appropriateness of stepping away for that one and then coming back.
Yeah, absolutely. This would be a come and go thing. I think what we assumed was we're going to get it in order to entice the elected leaders. Now, Councilmember Woodard even comes to our board meetings, but the other elected leaders don't like to go to all day things and participate in things. And so, but entice them to do the intro and let them kick it off, and then they can leave if they want, or others can stay. But really, and Eric and Jen, you can correct me if I'm way off base here, but this is what we keep talking about, was, in my mind, one of the things that Houston did over a 9-year period, they decreased homelessness by 5,000 people and cut it in 55%, was they had a coordinated system, and everybody in the city, in the county, bought off on the 5-year plan of the COC. And it doesn't have to be called a COC 5-year plan. It's just a community homeless plan. And you get all of the municipalities to buy off on it, all of the boards that are funding agencies to buy off on it. You get all of the business community that wants to participate but doesn't know which direction to go to agree to it. And you get the elected leaders to buy off on it. And then you're all singing off the same sheet of music, and you can coordinate your system better. And that is what Houston will tell you is they built a lot of low-income housing. They built 7,000 units of low-income housing, but they coordinated their system and their plan, and they only had one plan. You didn't have multiple people with different agendas because everybody agreed on that plan up front. So the goal of this retreat would be to get as many people to buy off on a 6-month process to get to the plan. It's not to come up with the plan at the retreat, but it's to get everybody to buy in on a process of small groups that work on each part of the system and set goals and set programs that work, so that we can, at the end of 6 months, come back together as a group and say, this is what the real 5-year plan is that we're all going to buy off on. So that's my hope for the retreat. And I think we got a pretty good framework where you set up, you do some ice breaking. Julius and Morgan are going to work with me on mapping, because we're all going to be in person, because Omicron is going to have peaked and gone way down by February 14th. Then we have lunch, and then we move into a discussion on coordinated assessment and the planning process. So with that, I'll be quiet. Eric.
Well, thanks, Ben. And again, I just would reinforce what you said. And again, I think what I think just conversations I've had with Tim, and I think electeds from different levels, is that I think we can agree to a plan together. Now, each of the jurisdictions, or each of the different funding authorities, is going to potentially have different priorities for their dollars. But to me, if we have this nice kind of menu layout, to me, I think that it allows everyone to kind of see where they can kind of leverage, that also matches their priorities. And we'll certainly get down to, I think, those more complicated conversations where some things may be a little bit more costly, than we would like it to be. But again, to me, if we can align, basically, I think funding priorities for these different agencies as best we can, and then we're just left with that handful of kind of the harder problems to solve. That's still, I think, a better outcome than where we've I think been in terms of silos. So I think that commitment, at least the county and the city, at least that I've made, for Tim, and Tim has likewise, like, we'll plan together. And again, we can't speak for our electeds necessarily in terms of where ultimately their funding priorities are going to be, But, I think that, if we take the proverbial, one side's going to prefer housing and one side's going to prefer something else, well, then we have a target rich environment. I think there's enough that we can put on this that's going to allow people to kind of align and really support the areas that they think are most important for our community. And I think that's pretty powerful. And then as there's still gaps, and whether it be things like, behavioral health or, drug addiction or otherwise, where there needs to be more support, to the county or to the system, in terms of those resources, then we're figuring out how to kind of fight for that together. So, I think that it is, I think, a necessary step for us to do, because all I've ever suggested to any of at least the electeds I've served is that, if we can plan together and get to kind of, what that, 80 or 90% alignment is, it allows all you good people to go out and get good work done. And then if we're still kind of, trying to work through that 10 or 20% that is, gaps or challenges, well, then we're able to focus more time and energy on that, I think, in a constructive process. So I look forward to that. I will, I think voice to this group again that I do think that trying to make sure that the elected voice is heard, but then also we have the opportunity to go make sausage, necessarily, as good experts that you are, is going to be, both those sides are important. So, we'll work on how to best structure that as we can. And again, I'm happy to answer any questions. And Jen, if you have anything else to add, happy for you to do so.
And Eric, since you missed the beginning, Councilmember Peets and Councilmember Woodard, I don't know if you've met Eric before, but Eric's the IT director for the city, and he has been acting division director for CHHS at the city of Spokane for the last five months, and he's done a stand-up job of helping us out.
Well, yeah, and technically it's NHHS, but most of my time has been spent on the CHHS side. Now with Jen on board, we've got a great partnership going to kind of help continue to kind of push this work forward. Again, I think both these pieces to me are kind of important. I mean, the elected alignment is key, right? Because if we don't help, I think as staff, try to provide, I think those good opportunities for alignment, right? Then I don't think we're helping them as best we can.
Is it possible to have, as like entry into the retreat, everybody that attends has to go through coordinated assessment, a dummy, for all the elected, and because then they get the flavor of what we're asking people to go through. And secondary is that, I've been pushing for a long time, surveying the homeless, survey them. Maybe if we can't get it, in the PIT, but maybe at the Homeless Connect, actually what are they identifying as should be the priorities? I think I would love to see that.
Actually, I'm working on creating focus groups for youth and young adults specifically who are facing homelessness about the coordinated entry system. It's just funny that you guys are talking about this, because I'm working on a list of questions as well as a sort of information packet that would be like coordinated entry for those who don't know what it is. So I wonder if there's some areas of collaboration there, because I work specifically with youth and young adults. But if anybody's interested in collaborating on creating that information packet, please reach out to me. I'd love some help.
Yeah, and I guess Dale, that can, both the work Gage is doing and what you're suggesting on surveying can be used as part of that 6-month planning process. Absolutely.
Yeah.
Okay.
I think having attendees, and even if we just make it voluntary, where you kind of help us have this, booth with a few folks that are just doing the coordinated entry piece, even if it's not mandatory, I think could be a pretty awesome thing, Dale. I'll go through it. Happy to.
Me too. Yeah. So I think we'll talk about that, but that's great. Arnie, did you have your hand up?
Yeah, I just wanted to know, since I haven't gotten the information, I'm trying to get caught up here. What time would the retreat start?
It'd be 10 a.m. to 5 p.m.
Okay.
And I did check today after I checked the surveys, and I noticed that was the day where everybody said they were available. I checked with the convention center this morning and they've locked it in for us. So I'm gonna send an appointment out. I don't hear anybody like screaming at me that that's awful. So that means I'll have to buy you all Valentine's. You all get Valentine's cookies or candies from Ben. And we're just really gonna knock on wood that Omicron is gonna have peaked and gone away by then. I am actually fairly convinced from looking at other numbers elsewhere that we should be okay by then. And okay.
Then, that's the only concern that I would have, in terms of, 2 weeks versus 3 weeks or 4. And let's just realize, obviously, a lot of providers are facing some great difficulties right now, and certainly them climbing out of it will also take some time.
Yeah, all the dates I used at the end of February or early March just were awful attendance, like 2 people out of 10. So I'm gonna roll with it. I'll send an appointment out tomorrow. I'm gonna stop though and have some quiet so that if there's reflections on what Eric or I said as the goals and the structure, you have an opportunity to weigh in. I'm taking that silence as we're okay to move forward. And I don't have any other agenda items. How exciting to be able to get a meeting done in 90 minutes instead of 120. I know, Eric, are you back east right now?
I'm just over at JBLM
Okay.
on the west side.
All right. Well, thank you for dialing in. I appreciate it. I appreciate everybody's work. Julius and Morgan, that was great. And I'm really glad we got to approve that. Andre, thanks for heading that up. Everybody that had updates today, thank you. Arnie, what do you got?
Just make sure you forward me stuff that was forwarded to everybody else so that I can catch up with the forms that I need and the
You're number one on my
stuff.
sheet of paper. Yep, you're number one on my sheet of paper to follow up with. I'll get that one done before 5 today.
Thank you.
Can I be number 2 on that list, Ben?
Yep, Gage, you need stuff?
Ben, everybody that was added today probably needs stuff because they wouldn't have been on our original distribution list.
Can I be number 3, Ben?
Evan.
Didn't mean to start anything.
And and number 4 is Brandy. Ken.
Yeah, thank you.
I'm on it. You'll get follow up from me.
Maybe
you will get so much follow up from me. You'll be sick of me. I appreciate it. I'm going to let everybody go. I'm signing off.
Hey, Ben, hold on. Heather, can you get it with everybody new on the board that came in? Can we get a new list sent out of members?
Yeah, I need somebody to send me those email addresses for our new folks. I do have Gage's already, but everybody else, I don't have that information.
I'll get that to you.
Okay, sounds great. Then we can update that and get that out.
Thank you. Okay.
Welcome.
All right. Thank you, everybody.
All right. See ya. Bye. Thank you. Bye.